Your pet is not being dramatic. The paw licking that has been going on for 3 weeks, the face rubbing against the carpet, the watery eyes that you have been attributing to something in the environment without being able to identify these are not behavioral quirks and they are not going to resolve on their own. They are your animal's only available method of communicating that something invisible in the air around them is triggering a biological response their immune system was not designed to suppress quietly. Seasonal allergies in dogs and cats are among the most consistently undertreated conditions in companion animal care, not because owners do not care, but because the symptoms are easy to rationalize as minor. The connection between the season and the suffering is not always obvious, and the conventional treatment options feel like they require a veterinary visit that most owners try to delay when the symptoms seem manageable. By the time they are not manageable, the secondary infections from chronic scratching, the skin damage from persistent licking, and the behavioral changes from sustained discomfort have compounded a problem that was much simpler to address in its early stages. The peak of allergy season in the Northern Hemisphere runs through July, which means right now, in the exact weeks this video is reaching you, the pollen counts, the dust mite populations, and the mold spore levels that trigger the most common pet allergies are at their annual maximum. What your pet is experiencing right now is not going to naturally improve for several more weeks. What you do in those weeks determines whether the allergy season ends without lasting consequence or produces the secondary complications that chronic untreated allergic inflammation consistently generates. Let me explain the biology before the remedies, because the natural approaches that actually work do so by addressing specific biological mechanisms, and understanding those mechanisms is what separates an effective natural remedy from something that makes the owner feel helpful without changing anything the animal experiences. Seasonal allergies in pets are a response to environmental allergens, predominantly pollen from grasses, trees, and weeds, dust mites, and mold spores that the immune system has learned to classify as threats. When the immune system encounters these allergens, it triggers an inflammatory response that releases histamines and other chemical mediators into the tissue. In humans, this manifests primarily in the respiratory system, the sneezing, the runny nose, the watery eyes that everyone associates with hay fever. In dogs and cats, the skin is the primary target of this inflammatory response, which is why the symptoms are predominantly dermatological rather than respiratory. The paw licking is the animal attempting to relieve inflammation in the feet and lower legs, which are the areas with the most direct contact with outdoor allergens. The face rubbing relieves the itching around the muzzle, eyes and ears where pollen accumulates on the short facial fur. The ear scratching reflects the inflammatory response in the ear canal, which is a warm, enclosed environment where allergen-triggered inflammation can progress to secondary yeast or bacterial infection faster than in any other location. Chamomile is the first natural remedy with genuine evidence behind the mechanism, not because it is a traditional herb used for centuries in human folk medicine, but because the active compounds in chamomile, specifically apigenin and alpha-bisabolol, have documented anti-inflammatory and antipruritic properties that address the histamine-driven skin inflammation directly. A chamomile-infused rinse applied to the paws and lower legs after outdoor exposure reduces the allergen load on the skin surface, delivers the anti-inflammatory compounds to the most affected tissue, and provides relief from the itching. The preparation is straightforward. Steep 4 to 6 chamomile tea bags in 2 cups of hot water. Allow the infusion to cool completely to room temperature and apply it to the affected areas with a soft cloth or by brief submersion of the paws in a shallow container. The rinse does not need to be washed off. The compounds are safe for topical contact, and the residue continues providing anti-inflammatory effect as it dries. For cats, who are more sensitive, a more dilute preparation using 2 tea bags in the same volume of water is appropriate, applied with a cloth rather than submersion, which most cats will not tolerate. Omega-3 fatty acids are the second intervention, and this one operates at a fundamentally different level from the topical rinse. While chamomile addresses the surface symptoms, omega-3 supplementation modulates the inflammatory cascade at the immune system level, reducing the severity of the histamine response before it reaches the skin rather than soothing the skin after the response has already occurred. The mechanism is specific eicosapentaenoic acid and docosahexaenoic acid, the omega-3 compounds found in fish oil and certain plant sources, compete with the arachidonic acid that the immune system uses to produce inflammatory prostaglandins. When omega-3 levels are adequate, the response is modulated, not eliminated, but reduced in intensity, because the substrate available for inflammatory mediator production is partially displaced by the anti-inflammatory compounds. The research on omega-3 supplementation for canine atopic dermatitis is among the strongest in the veterinary natural remedy literature. Multiple controlled studies have shown meaningful reduction in pruritus scores with consistent supplementation over 6 to 8 weeks. The dosing matters. The anti-inflammatory effect requires adequate blood levels of EPA and DHA, which means the supplement needs to provide a meaningful amount of these compounds. For a medium-sized dog, 15 to 20 milligrams of EPA and DHA combined per kilogram of body weight daily is the range that research supports. For cats, who have a limited ability to convert plant-based omega-3s, a small amount of high-quality fish oil, approximately 100 to 200 milligrams, is safe. Allergen reduction through environmental management is the intervention that produces the most immediate and consistent improvement, not because it is the most interesting part, but because reducing the allergen load the immune system is responding to is more effective than any remedy. Wiping the paws, lower legs, and facial fur with a damp cloth after every outdoor exposure removes the pollen and other allergens before they transfer to the bedding, the furniture, and the indoor environment where they continue triggering the immune response for hours after the outdoor exposure ended. Washing the pet's bedding twice weekly during peak allergy season removes the accumulated allergen load from the surface, where the animal spends 8 to 12 hours daily. Running a HEPA air purifier in the rooms where the pet spends the most time reduces the airborne allergen concentration that continues triggering the immune response. These interventions do not require any products beyond what most pet owners already have, and their combined effect on allergen reduction is greater than any single remedy. Local honey is the intervention most frequently discussed in the context of seasonal allergies, and the mechanism that is usually cited is exposure to local pollen, which is supposed to desensitize the immune system to the allergens triggering the allergic response. This mechanism is plausible in concept but poorly supported. Where local honey has a more defensible application is as a soothing topical agent for inflamed skin around the muzzle and paws. Its antimicrobial properties reduce risk. The viscous coating provides a physical barrier that reduces allergen contact, applied sparingly to affected areas that the animal can lick, which they will, inevitably. The small amount ingested is not harmful to dogs or cats without diabetes or immune compromise, and the residual coating provides the barrier effect while it remains. Apple cider vinegar diluted to a 50% solution with water has genuine antimicrobial and antifungal properties that make it useful specifically for secondary infections. The acidic environment created by dilute apple cider vinegar is hostile to the Malassezia yeast species, most commonly responsible for secondary ear infections. Applied with a cotton ball to the outer ear canal, never inserted deeply, the dilute solution maintains the acidic pH that normal healthy ear canals maintain. For paw application, the same 50% dilution applied after outdoor rinses provides both antimicrobial protection and mild anti-itch relief from the acidic contact. The boundary between natural management and veterinary intervention is the most important piece of information because these remedies are for mild to moderate symptoms. They are not appropriate as a substitute for professional evaluation when the symptoms indicate the condition has progressed beyond what natural management can address. Ear discharge, visible skin infections, fur loss from chronic licking, or significant behavioral changes are all signals that the condition requires veterinary assessment. The natural approaches described here reduce allergen exposure, modulate the response, and prevent secondary infection. They do not reverse active infections. Understanding what natural remedies can and cannot do, and acting on that understanding before the condition progresses, is the most important form of care. Your animal cannot tell you the season is making them miserable. They can only show you, and now you know what to do when they do.